Okay, thank you. Thank you, Scott, and thank you, Shoshana, for initiating this, and to CFAIR and the North Central Regional Center for sponsoring this. Let me begin by acknowledging my collaborators, Naisha Black and Jim Williamson. This is work that I initiated, one of the last projects I worked on when I was employed by the Economic Research Service, and then it was published later in this year in the Applied Economics and Perspectives and Policy. And as Scott mentioned, the title is Implications of Healthcare Reform for Farm Businesses and Families. So now this work was done really before. We're learning, we're living the implications now, but it was some original work to sort of say, how might the Affordable Care Act affect farm businesses and families? Okay, so very briefly, the outline, I'm going to talk about the motivation for an Affordable Care Act and the critical provisions as they relate to both individuals and businesses, and then again what might be some of the impacts of the Affordable Care Act. Okay, by way of motivation, I'm comparing the U.S. Situation to the other 33 OECD countries, Organization for Economic Cooperation and Development. If you're not familiar with that, it's a group of the most developed countries in the world. So once a year they put out a report, came out 2 weeks ago, on health statistics. The U.S. is the bottom third of life expectancy for both men and women among the developed countries. It's second from the last in insurance coverage. Only Greece has a lower share of the population covered. The U.S. is the only country where the majority of coverage is from private insurance. It has the highest unmet care needs due to costs for both above and below income groups, and has the highest per capita health expenditures. So you probably have heard some of these statistics in the nightly news. I think this is a pretty compelling chart here. This is showing how the U.S. has the highest share of health expenditures as a share of GDP. So this lines up the 34 OECD countries plus the average of the OECD there in the middle. So you can see that 16.4% is the figure for the United States, and it's clearly an outlier. So there's good reason for some sort of a policy development when it comes to health care. Okay, so health insurance coverage among the whole U.S. population puts, again, the households that operate farms in perspective. In 2014, the share without health insurance was 10.4%. These are the latest statistics. And it had been pretty stable between 2008 and 13 until there was this 2013 to 14 drop of about 3%. In terms of farm operator households, they're not large enough to be statistically reliable in these large national surveys. So the Agricultural Resource Management Survey of USDA is the only place where there's this national statistically reliable data. And because there's so much competition to collect data on the arms, it's not an every year type of event. And normally, of course, things like health insurance coverage don't change that frequently. So at any rate, the latest statistics on health insurance of farm operator households is in 2011, and the percent insured was 9.3%, so significantly lower for the U.S. in 2011. There, I put the number for the U.S. It's 15.7%. And until we started asking that question, we really didn't know about insurance coverage, because you could argue, you would expect farm households to have a higher share of uninsured because they are mainly self-employed. But just like the general U.S. population, most of the insurance for farm operator households comes from employment-based insurance because of the prevalence of off-farm employment in farm households. A little bit about the provisions now, and I say a little bit, emphasis on the little, because the The law is 906 pages, I think it is. There's 13,000 pages of regulation, so it's a very complex law. So I'm just really going to be talking about a few of the provisions that relate to how I've organized this analysis. So first of all, I think everybody probably knows that it's a requirement to have private health insurance. And if you don't have health insurance, you pay tax penalty. And there's a refundable tax credit provided to individuals if you're what they call a modified adjusted gross income is between 100% and 400% of the federal poverty level. Now, the Affordable Care Act also provides states with the option to expand Medicaid. You may recall that the controversy associated with the 2012 Supreme Court ruling, or I'm not sure if the ruling was controversial, it settled the controversy about whether or not states had an option to expand Medicaid. And the court ruled that, yes, states did have the option. So that then caused some implications, of course, because the way the law had originally been designed was that it would be a requirement or an expectation that all states would expand Medicaid, and that's how in households with the lowest income would be covered, would be through the Medicaid program. So since states now had the option after this ruling whether or not they were going to set up and expand Medicaid, then that produced what I'll call a gap. There's some households, low-income households, that have fallen into this gap. And then if you have, if you're in a Medicaid expanding state, persons in households with income between 138% and 400% of the poverty level will qualify for a premium credit, and that's based on a sliding scale. Once you hit that 400% of the federal poverty level, then in fact there's no subsidies for a premium credit. And if you're not in the state that chose to expand, then that credit kicks in at 100% of the federal poverty level, but also ends at 400%. Okay, here's a map from the Kaiser Family Foundation. It's a great resource if you're not aware of it for information about the Affordable Care Act. And it shows the states, that mustard color, the states that chose not to expand Medicaid. So you can see they're in the Plains, Idaho, Wisconsin, Maine, and then the Southeast there. Now, I'm sure you've heard the statistic that about a third of farm operators are 65 years or older. Perhaps that's not surprising because, of course, the farm is often the residence, and just because you retire, you don't leave home. And although some of those are actually still pretty gainfully employed in agriculture. So, but they're covered by Medicare. So what I did here was to exclude the 24% of all farm families where everybody in the household was 65 years or older. So because we know that they are eligible for Medicare, let's just look at that 1.6 million farm families that had somebody under 65 in the household. And so what I've done then, and what I'll be showing slides, is to group this 1.6 million farm households by how the Affordable Care Act would affect them, assuming they had the same household composition as they did in 2011, again, the latest year for which data are available. So 7% of these would be now Medicaid eligible. 40% would be eligible for a premium tax credit. In other words, they had less than 40% of the federal poverty level for income. And 45% of farm families had greater than 400% of the federal poverty level. So they're ineligible for both the Medicaid or the premium tax credit. However, you know, it remains to be seen if they're actually paying less for their insurance now, because we know that farm operator households historically have paid more for insurance, again, because many of them were self-employed without insurance from an off-farm job, and so then they had to go directly to the marketplace and didn't have the benefit of the risk management pool associated with group insurance. Okay, so then that leaves 8% of the farm families that are in this area that I'll call the gap. So they're low income, but they're living in states where the Medicaid program is not expanded. So again, keeping with this categorization of the 1.6 million farm households, I'm showing the households that are in these 4 categories. And the major point then that I want to make from this is to show that regardless of the category, most of these households still get their insurance from employer-sponsored programs, but not surprisingly then, those that are in the gap or Medicaid eligible with lower income, they're much more likely to be uninsured and also to be in public programs and to have to purchase their insurance directly from the marketplace. And then the South has a disproportionately large share of these families that are in the gap. About 41% of all U.S. farms are in the South, but 55% of farm families are in the gap. You recall that map from the Kaiser group that showed a large share of southern states that have chosen not to expand Medicaid. Again, keeping with these 4 groups, I'm showing the average farm and off-farm income. So you could see, not surprisingly, those farms that are in the gap are Medicaid eligible. They have large farm losses. And then, of course, those that are above the 400% cutoff are ineligible for premium tax credits, have relatively large off-farm as well as farm income. This is showing the median net worth for those 4 groups. The point I want to make here is, you look at that median net worth even for the Medicaid eligible, or those in the gap, is really a pretty large median net worth when you compare it to U.S. households, about 5 times. But in order to make a living in farming, of course, you need a pretty good asset base. So what's unique here is that many of the programs that are means tested, like the Affordable Care Act, depend on both the income of individuals as well as the net worth. But when it came to the Affordable Care Act, net worth wasn't considered. So this is increasing relatively to other designs of the program, the options for farm operator households to benefit from the Affordable Care Act provisions. Okay, so now I'm going to switch to the core provisions of the employer mandate. And so the law defines applicable large employers, and there's lots of complications here for the farm sector in defining who's an ALE because of the seasonal hiring and the part-time hiring. And I've tried to use the ARMS data to mimic the way the law specifies that. And in order to get the complete data I needed to do that, I needed to use the 2009 Agricultural and Resource Management Survey here. Okay, so in terms of the Affordable Care Act, first of all, 80% of all farms don't even hire labor, so it clearly doesn't affect them. Of course, most of these are the small farms. And then there's 2 other groups that I'll separate out, those that hire from 1 to 24 full-time workers and others 25 to 49. And I just want to mention that the law did have some provisions in there for if they choose to provide insurance, recognizing they're not required, that there are some special provisions to assist these small employers in providing insurance to their employees. Okay, so now this is categorizing farms by whether or not they hire. So there you see nearly 80% on the left have no hired labor, and then these 2 groups in the middle that have some, and I'm also showing the second bar there for each of these farm categories, what share of total employees they have. So you can see that that last group, at least 50 hired workers, they're the ones who are required to provide insurance to their workers. And so even though they're less than 1% of all farms, they have a pretty significant share of the total employees. So I wanted to say a little bit more about that group. There was nearly 1,600 of them in 2009 who would have been affected, employing 29% of all full-time employees. They're mostly labor-intensive enterprises, not too surprising, fruits, nuts, berries, greenhouse, and nursery, and again, not surprisingly, as you know, the distribution of agriculture production disproportionately in the West. Half of them are what we would classify as non-family farms. Their labor expenses were nearly 40% of their total variable expenses. That's a huge share for any particular variable expense. And their combined labor was over $5 billion, or 22% of all labor expenses. And then in terms of the distribution of size, 22% of them had sales of more than 15 million. So now the other thing I want to highlight here is we did not know how many of these farms are already providing health insurance benefits to their workers. It's likely that some farms with 50 or more workers already were. And the reason we don't know that is, you know, to reduce respondent burden, the way the information is collected on the arms is as an expense for all employee benefits combined, because that's part of the expenses that are included in estimating net farm income of the sector. I also want to briefly mention something about the hired labor contractors. This information is from the quarterly census of employment and wages. Now, that only records information for, there's a certain requirement, a minimum size requirement of when you have to report. So it would not include necessarily all the workers, but probably most of the hired labor contractors. And so they too would be responsible for the Affordable Care Act if they were considered a large employer. And what I did here was I said, okay, let's assuming that none of them were currently providing health insurance and they all were required to. Again, we don't know the size distribution of these to know if that's the case. And they passed all the costs on to farmers. How would this affect the net cash income of the sector? And it would imply less than a 1% decline for the sector. But again, since these workers are concentrated on certain farms, that would be significantly more for some of the sectors. So here's the interesting question, is how will employers respond? Will there be more use of robotics and less use of hired labor? We've seen evidence elsewhere that there's a decline in the use of labor on farms, and I could go into more details on that if there's an interest. And there's also some anecdotal evidence on robotics, trimming wine vineyards with the use of robotics, for example. And we've seen a decline in undocumented workers in this country. The Pew Research just released some information on that to show that it's stabilizing for the first time in a decade or so. Will large farms adjust their labor or reorganize into multiple smaller units so they stay under the 50? You know, we don't know that. Or contract for labor to avoid the mandate? Or will there be more use of direct hiring and offer benefits and spurred on by the need to have a reliable workforce? So the information has not been available since 2009 on employers, and it will be collected for 2015, and the data will be available for analysis in 2016, so we'll actually be able to get an answer to some of these questions. But we have seen we've seen some new shifts between in expenses and in labor, according to secondary sources of these indicators between 2013 and 2014. Now, how much of that is due to the Affordable Care Act? You know, we simply don't know, since there's so many other factors like what's going on in the Mexican economy versus enforcement of immigration laws here, et cetera. But there certainly has been concerns expressed among producers about access to workers. Okay, so that really concludes what I had to say. I have some information here for the ERS website, a recent ERS pretty comprehensive report on healthcare for both farm and rural households, a couple of articles, and here's some journal articles, co-authored with some of my long-standing colleagues, Hisham El-Astin and Sheikh Mishra. There's my contact information. Feel free to contact me. And if you're interested in the exact wording of some of the ARMS questions and a link to the survey instrument, I have a couple of slides here. And so when we post these presentations, you'll be able to find the link more easily. Okay, thank you.